Good afternoon, and welcome to the COVID-19 Daily Briefing. My name is Dane Boland, the Assistant Parish Administrator. It's been a while since we've met, but before I turn over to Mr. Grimion, you're going to hear a reoccurring theme today, and that theme is that we're hitting the mark on testing, and we're ready to move into phase 2 as the governor's guidelines. You also hear that although we're ready, we still need to remain cautious and still practice social distancing. So with that, I'll turn it over to our Director of Homeland Security, Mr. Grimion.
Thank you, Dane. I have one follow-up and then 2 new items today. Dane talked a little bit about the testing. We completed what we called our phase 2 of testing. We had been doing testing around the parish and Calcasieu Parish. If we added in the Burton testing, which we tested 422 people and 1,519 during the month of May with our mobile testing, that was a total of 1,941, which is about 20 or 25% of our target for the whole parish. So it was worth the effort, and it afforded some people access to testing that may not have otherwise had that access. Now, for what we've been waiting on, here's a few of the guidelines. I'm going to read a few of these. Obviously, this is not the complete list, but for phase 2 reopening. So what's new? Spas, massage establishments, and esthetician services, tattoo parlors, pool halls, bowling alleys, and skating rinks, event centers and wedding venues, outdoor playgrounds and play centers, bars without LDH food permits at 25% capacity. Now, this list are things that were already open but will be moving from the 25% capacity to the 50%. Retail stores including malls, places of worship, restaurants, gyms and fitness centers, casinos and video poker establishments, theaters, skating rinks and bowling alleys, museums, zoos, and aquariums, and solo and non-contact sports, and bars and breweries with LDH food permits. Those will all be able to be open at 50% capacity. Phase 2 reopening, what will remain closed? Amusement and water parks, children's indoor play centers, contact sports, concert and music halls, and sleepaway camps. And then there's a special note on this is on the governor's announcement. Live entertainment is not permitted inside any building or indoor function. Now, obviously, these are just a few of the items that were on the list that the governor covered. The best source of information for this is on the internet, and it's a website called opensafely.la.gov. And if you go there, there are literally pages of things that go into a lot more detail than what we covered today. And the last new thing I wanted to comment on what is now Tropical Depression Cristobal. Currently, Cristobal has gone ashore down in the Bay of Campeche and has lost strength from a tropical storm to a tropical depression. This is only scheduled to last for about 24 hours, however, and it should emerge back over the Gulf early tomorrow or earlier sometime tomorrow. As it stands right now, none of the forecasts are bringing this storm towards our areas, aimed more towards central and eastern Louisiana. However, this is a disorganized tropical system, and we've seen these things before, particularly with the rainfall. If it's slow moving, it comes ashore and stalls, someone will get a lot of rainfall. So do want to caution people, they should keep up with the weather news media, weather broadcasts, internet, whatever way that you have of monitoring the weather, because things could change. But as I say, right now, we should be in the clear except for some rainfall. Do we have any questions?
I was just wondering, will the playground equipment at the parks, so the kids can play on it now, right? And if so, how often will it be cleaned? Or do you recommend that parents bring wipes and clean it before their kids use it, or what?
Teresa, the general recommendations, if you look at it, it says that playgrounds may be open, but they must be accompanied by adults. So I think that those are common sense practices that you're discussing.
Okay, all right, thanks.
As I said, more detailed information on the opensafely.la.gov.
Thank you, Dick. And as Dick said, we will be monitoring the tropical depression out there. And if there's a need to get back and call another briefing, we will do so. With that being said, I now call on the Regional Director of the Office of Public Health, Dr. Lacey Cavanaugh.
Hey, good afternoon, everybody. A few things to talk about today. One is that our testing across the PCR testing that we've been doing across the parish of Calcasieu is now actually expanded this past week to encompass the entire 5-parish region. So that's exciting. We actually have 3 mobile testing units that are in coordination with our local Office of Emergency Preparedness from all of our 5 parishes, as well as with the Louisiana National Guard, have partnered together to bring testing to the entire region. And the exciting thing is that all of our parishes are now starting to meet the baseline per capita testing marks that we were trying to reach at the beginning of May. So that's exciting news that testing access has really expanded. You can find the latest schedule of where and when those units will be, because they do move daily. You can find those on the LDH website, but tomorrow we'll have a unit in South Beauregard, we'll have one in Vinton, and we'll have one in Jennings tomorrow. So I encourage people who are concerned about being exposed to the virus or who are having symptoms to get tested. That testing comes with no cost and no information collected about insurance. And so it's open and available to anyone who can make it to those sites. Those sites are open Monday through Friday. Once again, they move around every day, but in general, they're open from 8 a.m. to 11 a.m. So that's good news. We've also continued to ramp up testing within our nursing homes across the region. Many of them have started to now test residents and staff of the nursing home on a regular basis. We are working hard with them to make sure that they have the capacity to do that if it's indicated, and excited that many of them are getting on board to do testing, because we know in the long run, as we do that testing, that it will eventually save lives, because we'll be able to identify the asymptomatic people in that high-risk population and make sure that we keep them from accidentally and unknowingly infecting other people or staff members. So testing overall is ramping up, and we're excited about it. The bad news is that, unfortunately, due to the tropical system next week and the threat of rain, the sites that were originally scheduled for next week have been canceled, and we plan to move forward with our schedule for mobile testing going into the 3rd week of June. That will be once again available in the 5-parish region. Little comment on our hospital systems and capacity there. Our capacity across the region in all of our parishes still looks pretty good. We did sort of toward the end of this week notice a slight uptick in the number of COVID hospitalizations in the region. It's still at a level that is lower, way lower than what we were when we were at our peak earlier in April. However, it is something that we have to monitor very closely, and it's a very real reminder that the event is still not over. We expect COVID to be around for a long time, and it's something we're going to have to always be watching for and monitoring for, especially as we move forward into new phases. So we are looking at that information on a daily basis, and are keeping a very close eye on hospitalizations across the region. Also wanted to comment just a little bit on what you've been hearing about with pediatrics, which is the multi-system inflammatory syndrome in children, which is the MIS-C that you've been seeing. This is a new sort of syndrome that is identified in pediatric patients under the age of 21, and the primary symptoms of this are going to be fever, abdominal pain, nausea, vomiting, diarrhea, rash, or fatigue. And those cases are typically associated with either a positive COVID test or a recent COVID exposure. So that's going to be part of the case definition. At LDH, we are tracking cases of this as they are reported by physicians in the community who identify a potential case. Those are being reviewed, and we have so far identified 13 cases across the state, and there's been one death, which is on our website. More information about that is on our website. But once again, another reminder that there's a lot that we still don't know about COVID. I know it feels like we've been talking about it forever. It certainly feels that way to me, but in the grand scheme of things, this is still a relatively new virus, and we're still learning a lot. And so, so we need to just continue to pay attention to things like that. And then the last point I wanted to make is that as we move into phase 2, each phase that we move into, it becomes even more important than ever to follow all of the guidance that you're probably all sick of hearing about, but that we've been talking about since day one, which is things like distancing from other people and mask wearing and hand washing. And it is definitely not the time for us to get complacent. I'll tell you that I think that mask wearing is something that I think that we probably have a little bit of room for improvement on. I know they're uncomfortable. I know they're hot. I know they make people feel short of breath. They make me feel like that whenever I've been wearing one all day long, but it does protect other people. We know the more we learn about this virus, we know that some particles are very fine in the air, and of course the mask is not 100%, but it really does a good job when you look at the scientific studies at blocking the large droplets and the medium-sized droplets that come out of your mouth whenever you talk. So especially whenever you are in close contact with other people, it's a key piece and extremely important if we want to be successful going forward. If we go back to being in groups and being around each other and we're not taking these precautions, I definitely would be concerned that we could take steps backwards, and I don't want to see that for our community. I want us to thrive, and I want us to move forward in a safe way, and even though it's not pretty all the time to wear a mask, it is a safe way to move forward. And so I really encourage people to think about that and to consider that. The other thing is that as we move into phase 2, we also have to think about our risk. And as we evaluate situations, we all have to make smart decisions about what things are safe to do and what things aren't. We know that there are certain conditions that lead to a less risky situation. And those are, you have less risk if you're attending something that is held outdoors in a well-ventilated space, rather than in an inside space where there's not good ventilation. We know the risk is less when people are spread out at least 6 feet from each other. There's not a magic wall at 6 feet that protects you 100%. Certainly in certain conditions, the virus could spread even further than 6 feet. But we know that in general, 6 feet is a pretty safe distance, and if we're spread out by 6 feet, our risk goes down. We also know that our risk goes down if our contact with other people is of a short duration. So if you're in an enclosed space with somebody for 2 hours versus 2 minutes, that's a big difference in terms of your risk. So the shorter the interaction, the less risky the interaction is. And the last piece is that we know that masks and we know that hand washing reduce the spread of this virus. So we should be doing that anytime we're in a situation where we're in close contact with other people. Not saying you have to wear a mask when you're out running or exercising, or if you're in your own backyard or in your own house. I mean, obviously, you don't need to wear a mask during those situations. But if you're going into the grocery store or the gas station and you're going to be passing by other people, if you're going into another establishment where you're going to be close to people, you really want to avoid being close to people to begin with. But if it's a necessity and you have to be, then consider wearing a mask, because it is effective and it is going to help our community continue to take steps forward. So that's all I have, and I'll take questions.
Do you have any numbers for the pediatric cases in Calcasieu and or the region?
Not at this point, because the numbers are so low. We follow when it comes to releasing information about contagious and infectious diseases or any other information that could potentially be protected health information, we usually follow CDC guidance and start releasing that sort of information when the number of cases starts to get above that 5 to 10 threshold. Because if you've only got 1 or 2 cases, or a very small number in an area, then you could potentially compromise personal health information. And with 13 cases across the state, regional data or parish level data is not yet available. But I expect that if we get more cases, that then eventually that will be available.
Is it known yet if that pediatric version of it is contagious?
Well, it's related to COVID, or we think it's related to COVID. So I would say that probably so. Now, whether or not children who are exhibiting those symptoms are still actively contagious, we don't know the answer to that question yet. It probably depends on if their COVID test is still positive, or if they're coughing or have any other respiratory symptoms of COVID. So we don't know if once you're symptomatic, if you're still carrying the virus. But we do know it's related to COVID in some way, and we do know that COVID is contagious. So kind of got to look at both of those angles.
Thank you, Dr. Kavanaugh. I think we've said it a lot, but we really do appreciate your expertise that you bring to the citizens of Calcasieu Parish. So thank you again. With that, I want to introduce some members of our executive policy group. In Calcasieu Parish, we're kind of unique. So we have an executive policy group which consists of the 6 mayors, the sheriff, and the president of the police jury. It's unique, and I will tell you, it's been a pleasure watching them work through this and in other situations when they're called upon. So with that, I'd like to turn over to our president of the police jury, Tony Gilry.
Thank you, Mr. Dane. Just before I give my report, just a short prayer. We're going through such difficult times right now, and I just figure a short prayer. Heavenly Father, come to you asking for your blessing and guidance in the matters at hand. Because we cannot know or understand God's purpose until he reveals them. He changes times and seasons. He reveals deep and hidden things. He knows what lies in darkness. Help us move forward in all areas of our lives. This I pray in the name of the Lord. Amen. Here in Southwest Louisiana, we continue a high level of testing to keep the community better informed so that we have a much more information as much as we can for making decisions. Our community is safer and safer when it comes to the virus, and we want to stay that way. To do that, we must all remember to do our part and to continue social distancing, wear your mask, wash your hands, and take recommendations from our medical professionals seriously. We also want to remind people that we are in hurricane season, as Mr. Grimion said. So like any other year, we recommend you make sure the necessary storm preparations. So, know that your elected officials remain in constant communication for anything that comes our way to keep our community as safe and prepared as possible. And at this time, I just want to call on the mayor, Mr. Hunter.
Thank you, President Guillory. Good afternoon, everyone. I just want to reaffirm that Southwest Louisiana and the city of Lake Charles is absolutely ready to move into phase 2. I agree with that decision, and I believe that the majority of our residents feel the same way. And I've been able to visit with a lot of business owners over the last few days. And I am very proud of this community. I'm proud of our residents. I'm also proud of our business owners, and what they have been through over these last couple months has been significant. Now, certainly, we've said it time and time again, and I think it's important that we realize this event has affected people in different ways. To some, it has meant a business being closed for a couple months. To some, it has meant that they have lost a family member forever. So both of those are very real things. But as we do move into phase 2, we acknowledge that many businesses will be reopening. We encourage citizens not to throw caution to the wind, especially our elderly population and those that have pre-existing conditions. And at this point, people are able to make decisions for themselves. They really have throughout this entire crisis for Southwest Louisiana. But we call on people to be responsible and know that if you have certain pre-existing health conditions, or perhaps if you are one of those populations that is encouraged to continue to remain vigilant in your interactions with other people, recognize that about yourself. To the rest of the population that does decide to begin shopping again and going out to restaurants, the City of Lake Charles wanted to encourage people to feel safe at those locations. We recently launched the Shop Safely LC program, and we've been going around to different businesses and asking those business owners to take a pledge. And that pledge says that they are adhering to all of the recommendations of their regulatory agencies. We did not want to place a further burden on our businesses and require yet another certificate or license from the city apart from what they already have. But we do want our businesses to follow the regulations that are being set down from their regulatory agencies. We believe the vast majority of these businesses are doing that. And if they take the pledge and someone sees that placard on the entrance to a business, they can rest assured that that business is taking things seriously. And again, we know that there's many different emotions about getting out back into the community, but it is important that we support our local small businesses. They really are the backbone of this city. And so anyone that would like to participate in that program, please reach out to my office. You can email Odelia, that's ODELIA .sweet, SWEET, @cityoflc.us. It's been a phenomenal program. We've had a lot of positive responses so far. As far as the City of Lake Charles, an update for us from Phase 2, one thing a lot of people are asking is about the Civic Center. And the Civic Center will remain closed during Phase 2, and that was after a lot of communication with state agencies, understanding that music halls and live entertainment would still be curtailed under Phase 2. And I'm not going to speculate what's going to happen after Phase 2, but it's my hope that would change. But during Phase 2, the Civic Center will continue to be closed. And that's the end of my comments, and open for any questions if there are any.
Is all of this going to, what if any effect is all of this going to have on July 4th?
Thank you, Teresa. That is a great question, and we are going back and forth with that right now. We have reached out to other cities throughout the state to see what they have done. I can tell you that we are very concerned about hosting Red, White, Blue, and You in its traditional form. We're going to be making a decision on that very soon. But based on the guidance that we have received from the state, reading what is recommended and not recommended by the CDC, what I'm comfortable saying today is we are very concerned about hosting Red, White, Blue, and You on July 4th in its traditional form. And we will update you when we make a decision on that.
Thank you, Mayor Hunter and President Guillory. Also in the executive policy group is Mayor Bob Hardy, who is with us today. Mayor, good to see you. Hope everything is well in Westlake. With that, Mayor Hunter talked a lot about business and getting businesses back open. And with that, we have a guest who's coming up next, Mr. George Swift with the Economic Development Alliance, who's going to talk about getting these businesses open and things that they will need to do so. So, George.
Thank you, Dane, and it's good to be moving into Phase 2 tomorrow. The proclamation from the governor gives more details, as you've heard, but we want to encourage our businesses to go slow, to do things right, as you've heard. While we don't necessarily like to wear a mask when you're dealing with the public, it's going to be a requirement for business people, and certainly recommended for customers to wear a mask when you go in a store. And I know I went in a grocery store yesterday, and I would say 1 out of 10 might have had a mask on. So we've got some improvement to do. And the worst thing we could do is to not take this seriously and say, okay, it's over, and then have another outbreak and have to shut back down. That is our concern about the small businesses, because they have had such a difficult time. They need to come back open, and with the phase 2, they can, in most cases, get up to 50% of their business capacity, so that's a good thing. Having our casinos reopen and getting back into business is helping to reemploy hundreds of people. The hotels have been drastically impacted, and they'll come back as business travel gets out. But again, we've got to be careful and be safe, and we'll all be better off in the long run. One of the things that, of course, businesses have had financial strain, and hundreds have had assistance from the CARES Act, the PPP, Paycheck Protection Program. And just yesterday, the U.S. Senate passed a bill that the House had previously passed that gives more leeway to those businesses who have gotten those PPP loans. You will be able now, instead of an 8-week window, to use the funds and to repay that and to have it forgiven. They've extended it to 24 weeks or until the end of the year, whichever comes first. A lot of businesses are just reopening, and so they were not able to take advantage of that, so that will help. And then if it's a loan and not a forgivable amount, they can now take up to 5 years instead of 2 to pay the money back. And so this is going to be helpful. Believe it or not, in the second round of funding from the CARES program, there's still $130 billion available. And I think what it is, you know, when this initially came out, a lot of big companies got some money, $20 million and all that, and it was a disincentive for the small businesses, but the money is there. And so if you need financial assistance, you can go to your local bank or your credit union and apply for the PPP funding. And I think that can help a lot of businesses, so we're excited about that. The state of Louisiana, the Department of LED, Louisiana Economic Development, has a small business loan program, and you can go on our Alliance website or LED and get details about that. And then the city of Lake Charles has a grant program. So there's some assistance for our small businesses to get back and hopefully to survive. Also, the Department of Economic Development announced yesterday that they now have an e-commerce training program. We did a survey early on in the closure and found that about 40% of our businesses were not equipped with technology so they could operate remotely. And so if you do not have an online presence and you're in business where people can order or make reservations or whatever, you're going to be in trouble in the future. So take advantage of this program from LED. Also, we have our business incubator here at the Seed Center. We think, and we've had several folks contact us, they may be displaced, out of work. They've had an idea for a business. They want to start a business. Well, we've got a place for them and some assistance to help them get started. So in these difficult times, it also is a time of opportunity. So take advantage of that. And then when you look at things going on in our economy, you know, our area functioned more than probably most areas of the country. I know some areas, they had a thing about 3 weeks ago where the Ford Motor Company plant reopened. Well, all of our industry was open all during the time. Our biggest impact, of course, was the gaming and hospitality industry. But we also have been having a lot of prospects, industrial prospects, still looking at our area. We're meeting with them virtually online rather than in person, but there's still people looking at Southwest Louisiana. We have, of course, the LNG industry, which has been very hard hit, but we have Venture Global down in Cameron Parish is still undergoing construction, Cameron LNG has completed their third train. Some of the shipments have been delayed. That's a concern. We have about 3 other LNG projects that are pending, and so we're still hopeful that they will come through. It may be later this year or early next year. So the thing is that I want to emphasize is with our industrial base and the aviation component out at Chennault and all the other things that we have in the area, we think we can rebound quicker than most areas. And so we're optimistic if we can be of service to any of the businesses. Our Alliance website, allianceswla.org, is available. We have a lot of information on there, and appreciate anybody contacting us if they have any questions.
Thank you, George. That brings us to the end of the agenda. Now at this time, I take any questions. The sheriff is there to answer any questions that you might have today.
The only thing I was thinking about, we are still getting calls and complaints from people who are having difficulty taking care of their business with regard to unemployment. And I also had a question about whether extended benefits are going to be provided for those, I guess, who are still out of work.
I don't know that answer that question right now. Maybe George does. I don't want to put George on the spot. But I tell you what.
Well, they have not made a decision on that, but I would expect it would be, but there's been no decision yet.
And I know that's not the answer, Teresa, but what we've learned, one thing through all this, is that things change daily, sometimes hourly. So if things change, we will definitely get you that answer. How's that? Any other questions? I want to thank everyone for tuning in today and showing up. Thank you for our speakers and the folks who are on the Zoom meeting. With that, I encourage everyone to be safe and have a wonderful day. Thank you all.